Ventilators are a necessity for some patients battling COVID-19. While not every patient needs one, those who do can't survive without it. Today, we spoke with a Valley doctor about how it works and what makes it so important during this pandemic.
There's by no means, it's not a guarantee that you're going to survive. But if you need a ventilator and you don't get one, you're for sure not going to survive.
Ventilators are on the top of the list when it comes to medical supplies to treat COVID-19 patients. One some Arizona hospitals are trying to stock up on in case of a surge in positive cases. But the fear we don't have enough is only one part of the problem. Dr. Natalie Strand spoke to us today at Mayo Clinic where she was seeing patients. She stressed to us the real issue with ventilators.
It's not only the amount of ventilators you have, but it's also the turnaround time between patients, so that you don't have to make that decision of who gets one and who doesn't.
Because COVID-19 is so severe, patients can be on a ventilator anywhere from a few days to weeks, the machine taking over for the lungs.
You know, most people think of your lungs as kind of air-filled balloons, for example, but really it's a better image to think of a sponge. And if you think of a sponge soaked in water, that's kind of what pneumonia does to your lungs.
That's what stops these patients' lungs from doing their job, and a ventilator is brought in to take over. A tube is placed down the patient's throat, making a suction on the lungs where doctors can control your breathing.
You know, certainly people go on with the goal of getting them off afterwards and just kind of as a bridge getting us through the worst part of this infection.
A bridge that's vital to putting patients on the road to recovery. However, Dr. Strand says physical distancing is what's really making a difference in Arizona.
I'm really appreciative of everybody in the community who's made incredible personal sacrifices to help us have adequate healthcare resources and take care of the patients that do need to come into the hospital. So I think in general, I'm happy with what we've been able to accomplish in Arizona.